This is, of course, ethics and physical activity and health. And today's topic will be a little bit shorter, I think, than the other topics that you've listened to as far as the recordings go. Um, but something I can't neglect because um, we have issues related to life and death. Now, the reason why I'm going to keep this brief is that most of us will probably be working with people who are, somewhere between the ages of, 16 and 65. But there are a lot of us that are going into careers like PT and OT and nursing and medicine that are going to work with people. So people that are, sorry, excuse me, are on each of these ends of the boundaries, if you will. So here's some ethical issues related to life, if you will, or maybe more precisely the creation of life. There are some controversies, you will, or differing opinions when it comes to things like assisted reproduction. So we live in a society that medical technology allows us to do a lot more than we had, prior. I guess medical technology certainly has really come alive in the last 100, 150 years, So prior to these medical advances, these things weren't ethical issues because they just didn't exist. And so that kind of goes back to those bioethical things that we have mentioned back in, I think, lecture 5. But anyways, assisted reproduction would be then, assistance in fertilizing an egg, and hopefully then when that happens that you have a child, a fetus, come to term and be born. And so we have, this is again not an exhaustive list, but we have lots of treatments potentially that can help that process, whether it just be fertility treatments in the forms of medications or hormones, all the way up to in vitro fertilization or IVF, where we then, extract the sperm and egg from two people, fertilize the egg outside of the womb, and then implant fertilized eggs within a womb. And sometimes it works and sometimes it doesn't. And there are some ethical issues related to that. I'll give you one example. Besides, I guess a common argument would be, artificially creating life is, some people would say, playing God or messing with nature. And then there are other ethical dilemmas related to IVF in terms of, and we'll talk about this on the next set of lecture slides, in contemporary issues. Typically, lots of eggs are fertilized and may not be used. So if you are a believer of life beginning at the moment sperm and egg meet, then in IVF, the reality is there are lots of fertilized eggs that don't get used. So there's some ethical dilemmas there. Other things include surrogacy. So this would be, similar to IVF, but what you would do is implant a fertilized egg in the womb of a non-parent. So that's typically what happens, right? For whatever reason, let's say a woman cannot carry a child to full term, but her eggs are good. So her and her spouse or her partner have a surrogate. And this can get sticky because if you might imagine carrying a child for 10 months is very intimate, and obviously that can you have to be very careful with those types of situations. And so there's some ethical issues related to that. And then, of course, the big topic always regarding life is abortion. And because I've mentioned it before, I will just remind you at this point that it is legal in the United States but there are some differences at the state level. And so typically those differences come in the time in which that you can abort a fetus. So usually it's pretty early, and then late term abortions typically are illegal, but you would have to look at that state by state. But remember, Roe v. Wade, this was a big Supreme Court case in which established these reproductive rights. So that's kind of the, the beginning of life, or some concepts that you may hear about regarding the beginning of life. Here are some terms related to end-of-life care. I suspect, this is just me thinking, that some of you will more likely be working with individuals at this end rather than at the beginning of life. But irregardless, like I said, this is life, and you are a human, so having some knowledge of both ends is pretty good. But actually, a lot of you will have careers like physical therapy and occupational therapy, where you will potentially be working, especially in an inpatient situation, you'll be working with individuals who are terminal, and you're helping them with maybe daily activities of daily life. Just helping them to have the best quality of life that they can while they are at the end, if you will. Okay, so here are some terms related to end-of-life care that you should be familiar with. Like I said, especially if you're going into those healthcare professions. Curative care is very common and traditional in our medical system. When we provide curative care, we're attempting to cure the medical problem or reduce the issue of the medical problem. So certainly if you have, bronchitis or some other bacterial infection, we go for curative care. We supply antibiotics, we kill the offending bacteria, and hopefully all is well. We attempt to cure things like cancer, but that tends to be a little bit of a chronic or an ongoing condition. And then reducing medical problems like type 2 diabetes. So type 2 diabetes typically is not cured. It is managed, and we do a pretty good job at managing it if the client does what they're supposed to. So that's curative care. Palliative care, on the other hand, is aimed at reducing pain and suffering as the person nears end of life. Typically, people who are receiving palliative care are no longer receiving curative care. So what has been whatever the scenario is, this individual is no longer being treated to cure the problem. We are simply keeping them comfortable for the remainder of their days. Hospice is typically the provider of palliative care, and that can happen in different ways that we'll talk about here in a second. Sometimes the decision between curative and palliative care can be an ethical one, because there are cases that are often considered incurable or terminal, and so you may need, or you would have a medical professional recommend to a person or a family that they move to palliative care, and there may be differing beliefs on that, if they should move away from curative care to palliative care, and so on and so forth. And so that's it goes without saying that is a terribly difficult decision between the individual and the family or the support system. And then, of course, the individual has to be competent to make those decisions. So then if they're not, who's making those decisions? So that pops up. Sometimes a hospital ethics committee may take these cases and will then help, like I said, provide that support and the recommendations when to move from one to another. So hospice can be provided within a hospital itself. It can be provided in private centers or long-term care facilities, which is pretty common. These would be kind of, I don't want to say retirement communities, but sometimes retirement communities, but that's kind of a big, broad statement nowadays. But there are places, organizations that are called hospice, and they're typically they're typically companies that are providing palliative care. And then there are also companies that send individuals out to homes to provide hospice. And so an individual can receive hospice in their home. Advanced directives we've talked about already, with the exception of one. So I'll run through these pretty quick, and then we'll talk about the Uniform Anatomical Gift Act. So the DNR order informs healthcare professionals that a person does not want extreme measures taken to save their life during cardiac arrest. So as I previously mentioned, no CPR, no AED, no defibrillator, within the hospital, nothing. A DNR is a legal document. It's written, and it is placed in your medical file. So you have to be competent to request a DNR, and you can do that from your medical facility, who will help you take care of that. And then DNR orders, I believe I mentioned this in the last set of lecture slides, they're often recommended for those with terminal illnesses that are considered, very late stage with less than 6 months to live. A living will, if you'll remember, is a legal document that indicates whether an individual wants to be placed on life-prolonging machines, like I said, which would be any kind of life support. So if you cannot breathe on your own or feed yourself, those would be life support. This is a legal document. It has to be notarized. It has to be signed by 2 witnesses, because this is obviously a very important topic. And a living will, what does it do? Well, it helps to prevent controversy. If you'll remember back to the Terri Schiavo case, obviously she was very young. Many young individuals do not have these documents in place. And, it was not officially known what her wishes would have been. She was on life support. And so we... perhaps there was some kind of discussion between her and her husband. I don't know. But there was no legal document. And so because of that, there was a big ethical dilemma and controversy between primarily her husband and then her parents. So it can help prevent controversy. If things happen and people don't know that you have a living will and you're put on a machine before the living will is discovered, then actually the medical team, once that's discovered, has to begin withdrawing treatment, which can actually be another ethical dilemma, because once you are receiving treatment, there's the argument, this is just one argument, but there is an argument that you're still alive and you are being saved. And so then you have to withdraw that. That can be a typical, or it can be a difficult ethical situation. The power of attorney or healthcare proxy is when, an adult can hand over decision-making power to somebody else. You have to make that decision when you're considered competent, though. So you have to do this ahead of time before something happens. So when a competent adult, you now are not able to make a decision for whatever reason, like you're in a coma or something, or you become incompetent. This can be health or financial. They are separate decision-making topics. It can be one person. It can be 2 people. And if these individuals aren't appointed to carry out your wishes, then again, ethical dilemmas can arise and legal issues can arise. A lot like the Terri Schiavo example, right? So if her spouse has consent in the event that there was no living will. And that's eventually what happened. But there was enough of a case for many, many years to debate whether or not she should be taken off life support. So here's the new one. The Uniform Anatomical Gift Act. This was passed in 1968. So this allows anyone over the age of 18 to donate body parts for the purposes of transplantation after death. If you do not designate yes or no, then it does also allow next of kin to make decisions. And you've heard of these cases, I'm sure, where, especially with children, their parents can decide to donate organs or body parts to other individuals. This Gift Act also addressed donation for medical research or study. And so you can actually donate your entire body to medicine or research or science, however you want to think of it. You can donate your whole body or parts. And some people donate parts even when they're still alive. That sounds really weird as I say it, but let me give you the example. So sometimes diabetics that have real bad disease and are not controlled have their legs amputated. This happened actually to my grandmother. And so, leg was amputated above the knee, so you had a really nice big limb that was otherwise healthy. And so she donated that while she was alive to, I believe, the local university or something of that sort. So you can even do that. So this allows transplantation after death and allows you to gift that if you like. So just because that act was in place, and it has been in place since 1968, that doesn't mean that all of a sudden, it was easy and everyone was donating their body parts and we had all the hearts and kidneys that we could need. And we still don't. The needs for transplantation far outweigh donation. And so the Organ Transplant Act of 1984 actually created a network for registering and matching organ donor recipients. So the Organ Procurement and Transplantation Network is actually a private nonprofit organization that contracts with the federal government. So we have a nonprofit that works with the government to register and match organ donor recipients. And lots of things have been done within the last 25 years or so to increase donation because of that great need. And so you may be quite familiar with the DMV in California, the Department of Motor Vehicles, makes it really easy to register for this by noting when you get your driver's license whether you'd like to be a donor or not. And so they've really worked to make it easy for individuals to do this whole registration thing and such. And so that's kind of why this popped up. Now, there we go. Let's go back here real quick. Let me mention a few ethical dilemmas related to organ transplantation. Just because we have a network for registering and matching organ donor recipients doesn't mean that there aren't problems or issues that arise. So first and foremost, where you get put on the National Organ Transplant List is dependent upon lots of factors. For instance, individuals who are younger typically will go to closer to the top of the list because they have what would be considered more years of life available to them. Individuals who have conditions that have better prognoses than others may be higher on the list. Sometimes individuals who have been deemed to cause their own disease, like alcoholics, if they need a liver, they may be put lower on the organ transplantation list. So just because you need an organ doesn't mean you just get in line. They actually place you in a certain order on the list. And just because you're at the top of the list doesn't necessarily mean you'll get it. Because when organs are harvested, so when they are taken from individuals who have passed away, they have to be transplanted in a set amount of time, and it's usually not too long. So if you're number one, but you cannot get to that organ, because of it being far away or travel restrictions or whatever, you may not get it. So then there's other things that, even like I said, even if you're on the list, that may not be, just because you're number one doesn't mean you're getting the next one. The right situation has to come up. And then also like the right size. And then typically they will match, children and children, adults and adults. So sometimes it's hard to get a child and adult organ. So it's very situational. So there are some ethical dilemmas that pop up related to this. There was one, a handful of years ago now, and I can't remember her name, but it was a young girl who received, I believe it was a heart. No, I'm sorry, it was a lung. So you can survive with just one lung, but this young girl, she was young. She was, I think, less than 12 years old, and she needed a lung transplant. And they actually had a big court fight because they didn't want to give her adult lungs because of the chance of rejection. Well, the court actually agreed with the parents. Adult lungs were transplanted into this young girl, and they were rejected. So that's, not a good situation. But then she got a second pair of lungs, and that actually kind of heightened, if you will, the ethical debate around it, because obviously if these organs are scarce, now we have a young individual who's receiving multiple pairs of organs. So just kind of an interesting situation there. And so you will have seen or possibly heard of that case. Like I said, it was at least 2 or 3 years ago. So anyways, making end-of-life decisions, historically doctors provided only curative care. But now, because of technology and our advances in medicine, we're aware and have some pretty good ideas about when individuals are terminal and what can be actually cured. And because of that, then these documents can help people, family, healthcare providers avoid controversy and legal or ethical dilemmas if they know your wishes. So that's the purpose of these. Last topic for today related to life and death, but this is the other end, so this is death, and that is of euthanasia. And euthanasia actually means the good death. I don't know if you find that interesting or not. I did when I heard about that many years ago. And so euthanasia refers to the intentional killing of an individual to ease pain and suffering. So that's the important part here. This is not malicious. This is actually considered to ease pain and suffering. But it does result in an individual's death. So it automatically makes it very controversial. There are different types of euthanasia. And the reason I need to bring this up, although it sounds kind of morbid, is that there are ethical dilemmas related to different types. Passive euthanasia actually allows a person to die by withholding treatment, food, or water. Passive euthanasia is legal in all 50 states. So this is actually how Terri Schiavo died. Terri Schiavo died by passive euthanasia. They removed her feeding tube. So they withheld food and water from her, and it took, 13 or 14 days, and she eventually died. And that was passive euthanasia. This occurs fairly regularly. And like I said, it is legal. And usually, again, the people who can make the decision are the competent adults or those individuals who have been given decision-making power by an individual. So this happens. Passive euthanasia. Active euthanasia, on the other hand, would be intentional killing by, I put it in quotes, non-natural means. Typically, this, so we're not withholding food or water, but we're going to do something else to bring upon death. Typically, this is lethal injection of meds, although this can also be done by depriving patients of oxygen. That's a lot more controversial, but let me also mention with animals, we do active euthanasia all the time, right? We put our pets down when we make the decision that they are suffering and that they are not living a good life any longer. And so we do active euthanasia with pets regularly. We do also, I'll just stop there. Okay. Then there's another type, if you will, and I put this in quotes, physician assisted. So physicians, it is not legal for a physician to lethally inject medicine to kill an individual in any state. Active euthanasia is not legal in any U.S. state. However, what we do have is several states, you'll see them listed there, Death with Dignity Acts. These are laws that allow physicians to prescribe medications to an individual and then instruct them on how much to take that will end their life. And so this is Death with Dignity. Why is it called Death with Dignity Acts? It is because the individuals are choosing to end their own life, and there's rules around it. You have to be you have to be terminally ill. This can't be considered suicide. It has to be, there's set rules for this. But if an individual decides that they would like to end their own life to ease their pain and suffering, they can in California, Colorado, D.C., Hawaii, Oregon, Vermont, Washington, and Montana, although Montana, it's actually by a court case. So it's common law, not by statutory law. So it's kind of an interesting scenario there. There is a hyperlink on the California one. This website is actually pro Death with Dignity Act site, so I'll just let you know right there that I'm not trying to be biased, but I did happen to like their website. So they are a pro Death with Dignity Act group, nonprofit. But I did like their website because you can click on every state and it will tell you what is and is not legal. And that's what that hyperlink is on the California one. So if you wanted to check out California, you could. And then certainly you can look at that website for other bits of information. Like I said, just want to let you know there is a bias there. They are very much for these rules or these laws. So there's some thoughts related to life and death. Again, not trying to be morbid, but you will most certainly see them even if you're turning on the news in the morning. So hopefully it'll get you thinking about these things more fully, appreciate the things that healthcare professionals are doing. And as always, let me know if you have any questions, comments, concerns, and you take care of yourself.